Welcome to Friday Focus, April 21st, 2017. I talked about this at the Tuesday meeting, but I want to go and kind of write some things down to make sure you understand it. This is something that's real critical for everybody in our practice to understand. You know, we're moving our practice into the form of more non-surgical things. We really want to be on the cutting edge of advances in healthcare. We like to avoid complications rather than just, deal with them when they occur. One of the things that occurs, like we're doing the Orbera for weight loss, yet what can we do for people that aren't quite there yet? Do we have opportunities for them to work on their nutrition? We have SkinCare in our practice. We have dermatology at Shelby, and we're hiring a dermatologist for other offices over the next few years. And a lot of dermatology is managing skin cancer, and a lot of our cosmetic stuff is managing skin discoloration, skin sagginess, and both these conditions are caused by the same thing, both skin cancer and aging, caused by the same thing. And it's something that's important we understand what we can do to prevent it, and something we know about, so that makes us required to talk to our patients about it. When we know something that most people don't know, it's important we get the word out. So ultraviolet light, there's two forms of ultraviolet light, type A and type B. Ultraviolet light is from the sun primarily, but it also occurs inside of buildings. It occurs when you're driving in your car. The ultraviolet light gets through your windows and your windshield. The windshields and windows are polarized, so it reduces some forms of ultraviolet light, but it doesn't reduce very much of what's called ultraviolet light A. There's A and B. A and B. It doesn't reduce A very much, and the A ultraviolet light actually will go through a window, and it'll go through your skin. It'll injure the tissues underneath the deep part of your skin and also the deep fat compartments, and leads to more, premature aging and sagginess. We know sagginess occurs when the fat pockets deflate, the face kind of sags. When you're walking around in a building, these fluorescent lights, they leak ultraviolet radiation, okay? And it's not a radiation that's like a chemical or like a radiation plant spill, but it's radiation, and radiation damages tissues, okay? And ultraviolet radiation from the sun, from fluorescent lights, the stuff that goes through your car windows, damages your skin and makes you age. And a lot of our employees are very young, they don't think about it, so we're thinking about using sunblock. But what happens to our customers that are starting to think about prevention, and then they come into us when they're 50 years old with the effects of aging, we didn't tell them how to prevent it. So ultraviolet light, when it hits the skin, what happens? What causes aging and cancer? So ultraviolet light comes down from the sun or the lights or through your car window, and it hits your skin, and it stimulates an enzyme. And the enzyme is called, a group of enzymes called matrix metal proteinases. And there really are three big ones, but we'll just talk about one, which a name that you'll remember. So called matrix metal proteinases. The main one is collagenase. Collagenase. And collagenase is an enzyme that breaks down collagen. Collagen is a building block of your skin. There's also other things that collagen is found in, such as elastic tissues and some of the support tissues. So when the sun gets in your skin, it causes this collagenase, and there's another one called gelatinase and a couple other enzymes to be formed. And it starts eating away at your skin, so your skin gets thinner, and your connective tissues get thinner, and the skin starts to sag, it starts to become discolored, and it starts to get wrinkled. Okay, and this is caused by the sun, and it's caused by ultraviolet light activating these matrix metal proteinases. The notable one would be collagenase. So what can we do to block that? Well, we can use sunblock. Okay, sunblock. This is a spray. You can use a spray or cream. We use ones that have zinc or titanium in them. These are more effective sunblocks. They both absorb light and reflect it. What they'll do is they'll block this ultraviolet light from getting underneath the surface of the skin. So they lay on the outside of the skin. They don't get absorbed into your skin. They lay on the outside, little microparticles or nanoparticles of metals, and they wash off over time. And it just makes it so that the ultraviolet light doesn't go through your skin. So it cuts down aging and skin cancer. We know just using sunblock alone daily, even in the wintertime, or you're in your car or walking around a building, will make you look better in about 3 months. And we guarantee it. What else can be used? Well, we have some topicals that we know are very effective at reversing signs of aging. They reverse signs of aging, but they do it by altering the body's response to ultraviolet light. Okay, so when your body is not getting exposed to ultraviolet light, it can start fixing itself, but we're exposed to it all the time. We're driving outside and walking through buildings. Vitamin A is called a retinoid. retinoid. Now there's a form of retinoid that we use, it's called retinol, OL, and there's a form of retinoid that's an acid, it's called retin A. So A is the acid, the O is the alcohol. We use the retinol because it's much better tolerated. It works as good as retin A for sun damage and skin and stuff like acne, but it doesn't have the irritation associated with retin A. So we use retinol, and that is here, retinol. But what the retinol does is it actually prevents sun damage to some degree and heals things. So going back to collagen, collagen is building back your skin. There are cells called fibroblasts. And blast means to make, and fibro is like tissue, so it makes tissue. Fibroblasts make collagen. So fibroblasts make collagen. When the sun hits the skin, the fibroblasts slow down their making of collagen, but also collagenase is formed, and collagenase starts eating the collagen that the fibroblasts are making. When retinol is added, it blocks about 70% of the enzyme. So 70% of the collagenase no longer occurs. So they did studies where they exposed skin to sun, and they exposed skin treated with a retinol to sun. And they did it on somebody's butt cheeks. They treated one with retinol, one without. They did it to several people at the U of M. And they found that the side treated with retinol had 70% less collagenase, so it was 70% less likely at that time to get the skin to break down. Retinol also upregulated the fibroblasts. So the fibroblasts became more active, not in response to sunlight, but in response to the retinol. So so retinol works by blocking collagenase and allowing your body to make more collagen. So retinol should be used. We use it at night because when you first apply it, it makes you a little sun sensitive, but in reality it makes you less likely to get damage from the sun. But we use it at night. So that's vitamin A or retinol. Vitamin A and retinol are the same thing for the purpose of this discussion. Then we have vitamin C. Vitamin C. Vitamin C is used in the morning. What does vitamin C do? It does a few things. First off, vitamin C is kind of like a natural sunblock. When vitamin C is in your tissues, it penetrates pretty deeply. They actually put it like almost like a little fat so it can absorb in through your skin. And it attaches to collagen and elastin, makes it resistant to breakdown by collagenase. So when you have vitamin C on your skin, the skin becomes resistant to breakdown. Also, the fibroblasts that make the collagen, it takes little pieces of protein to make the collagen. Vitamin C makes this process happen easier. So vitamin C allows the fibroblasts to make collagen easier. So both retinol increases the number of fibroblasts, pardon me. Vitamin C lets the fibroblasts make collagen easier, and they both work to fight off damage of the sun. Additionally, if you use vitamin C in the morning, if you do get exposed to the sun, which we normally do, you'll get less redness. Okay, so it also blocks A and B light. So vitamin C protects you against the sun. Now you still need sunblock, but vitamin C is the additional protection. And the last major one I want to talk about is a glycolic acid. So glycolic acid can be a moisturizer or a wash. When glycolic acid is used in high concentration, it's used as a peel. We're talking about it for using as a daily topical. People use it once or twice a day. Glycolic acid does two things. Number one, it acts as SPF of 2.4. So you get a built-in SPF and it lasts all day. So that's one thing, you get decreased sun exposure. You still want to use sunblock. Number two is the glycolic makes your skin thickness 27% thicker by building collagenase. So glycolic moisturizer or glycolic wash allows your body to make more collagen, absorb more moisture, get less redness in exposure to sun, and makes your skin thicker, which leads to less wrinkles. Okay? All three of these main ingredients, all four of these, sunblock, retinol, vitamin C, and glycolic moisturizer will lead to less redness from the sun. That's good. Less discoloration from the sun, less damage from the sun. Moreover, when you're using these four products, you will have less skin cancer. Skin cancers are caused by the same metal proteinases, okay? Even melanoma, they're all stimulated by sun potentially, and these all block development of cancer. Additionally, when you're using these products, your skin will look better. You'll actually anti-age your skin. In fact, we guarantee it with our brochure. It shows that we will guarantee that you'll look 20% better in 3 months. It's guaranteed because it's actually 27% or 28% better. Not related to 27% from the glycolic, just in terms of pigment, wrinkles, discoloration, unevenness. Gets about 27% better, 28% better. And so we guarantee people 20% and they can bring it back. You don't have to quiz them how they figured out it wasn't 20%. If they don't want it, that's fine. The company will refund it because they're standing behind, our manufacturer stands behind it. This is obviously our company. So the skincare is something we need to talk to our patients about. We're doing skincare management. We're trying to treat cancers and dermatology. We're treating aging and discoloration with our lasers. What are we doing for preventative? Okay, we can impact our patients, impact our customers, and impact our community. We also have with the kit a moisturizer and a green tea face wash. These basically are work to decrease inflammation. The real workhorses are the center four, which is the sunblock, vitamin C in the morning, retinol at night, and glycolic once or twice a day. The moisturizer is an additive thing, but the real biggies are those four. And that's something everybody needs to know about. You can read about the different ingredients and the products in here. It tells you about what caffeine and stuff like that does in the like tea leaves and stuff like that do for your skin. They're all beneficial. The four that are studied the most are sunblock, vitamin C, vitamin A, and glycolic. You need to know those. Thank you very much.